Welcome, healthcare professionals, community advocates, and men who have sex with men (MSM), to an exploration of post-exposure prophylaxis (PEP), a powerful tool for HIV prevention among MSM. The importance of equitable access to this life-saving intervention. MSM continue to face a disproportionately high risk of HIV infection compared to the general population. This increased risk is attributed to several factors, including higher rates of unprotected sex. MSM may have a higher prevalence of unprotected anal sex, a primary mode of HIV transmission. Increased prevalence of sexually transmitted infections (STIs). MSM may have a higher prevalence of STIs, which can increase the risk of HIV transmission. Social and structural factors, social stigma and discrimination, as well as limited access to healthcare and preventive services, can hinder HIV prevention efforts among MSM. PEP, a shield against HIV infection for MSM. PEP, or post-exposure prophylaxis, offers a critical safety net for MSM who have potentially been exposed to HIV through sexual contact or other means. PEP involves taking a combination of antiretroviral drugs within 72 hours after potential exposure, ideally within 24 hours. The effectiveness of PEP for MSM. Clinical studies have consistently demonstrated the effectiveness of PEP in preventing HIV transmission among MSM. Studies have shown that PEP can reduce the risk of HIV infection by up to 90% when taken correctly and promptly. PEP accessibility for MSM, addressing barriers. Despite its effectiveness, PEP remains underutilized among MSM due to various barriers, including limited awareness and understanding of PEP. Many MSM may not be aware of PEP or its potential to prevent HIV infection. Stigma and discrimination. MSM often face stigma and discrimination, which can hinder their access to healthcare services, including PEP. Stigma associated with seeking PEP. Some MSM may feel stigmatized about seeking PEP due to concerns about perceived risk behaviors or disclosure of sexual practices. Logistical challenges. MSM may face logistical challenges in accessing PEP, such as transportation difficulties or limited access to healthcare providers who are knowledgeable about PEP. Overcoming barriers and expanding PEP access. Addressing these barriers and expanding access to PEP for MSM is essential for reducing HIV transmission in this population. This requires community-based education and outreach, raising awareness about PEP among MSM and their communities through culturally sensitive and accessible education programs. Training healthcare providers, ensuring healthcare providers are knowledgeable about PEP and its specific application for MSM. Integration into MSM-focused healthcare services, integrating PEP into existing healthcare services for MSM, such as sexual health clinics and LGBTQ+ community health centers. Addressing stigma and discrimination, implementing interventions to reduce stigma and discrimination associated with HIV and MSM. Promoting a culture of openness and prevention, fostering a culture of openness and prevention among MSM communities to encourage seeking PEP promptly after potential exposure. PEP as part of a comprehensive approach. PEP should be considered an integral part of a comprehensive HIV prevention strategy for MSM, which should also include PrEP for those at high risk of ongoing HIV exposure, promoting PrEP, a daily preventive medication, for MSM who engage in frequent unprotected anal sex. Increased access to HIV testing, promoting regular HIV testing to detect and treat infections early. Addressing risk factors for HIV infection, such as high-risk sexual behaviors and substance use. Empowerment and self-advocacy, empowering MSM to make informed decisions about their sexual health and advocate for their own well-being. Empowering MSM for collective prevention. Empowering MSM to take charge of their health is crucial for effective HIV prevention. This involves peer-to-peer education, empowering MSM to share information and support about PEP and HIV prevention among their peers. Social media campaigns, utilizing social media platforms to reach MSM with targeted and culturally relevant HIV prevention messages. Community-led initiatives, supporting community-led initiatives that promote HIV prevention and address the specific needs of MSM. Advocacy for policy change, supporting MSM to advocate for policies that promote equitable access to PEP, comprehensive sexual health services, and culturally sensitive care. PEP, when combined with comprehensive HIV prevention strategies, community empowerment, and addressing the underlying factors that contribute to HIV risk among MSM, has the potential to significantly reduce HIV transmission in this population. By prioritizing equitable access to PEP, fostering a culture of openness and prevention, and empowering MSM to take charge of their health, we can work towards a future where MSM are free from the burden of HIV.